If you leak when you cough, laugh, sneeze, run, or exercise, you're not alone. Stress urinary incontinence is one of the most common types of pelvic floor muscle issue, and it's treatable. I'm Amanda Olson. I'm a doctor of physical therapy and certified pelvic floor rehabilitation specialist. I'm going to walk you through what causes it and how to manage it with progressive exercises. Stress urinary incontinence is the accidental leakage of urine when you put pressure on the bladder. So coughing, laughing, sneezing, or exercising. It is most commonly caused by pelvic floor muscle weakness, and that can be caused by issues during delivery, pregnancy itself, after surgery, with general aging, or if you've experienced chronic constipation from straining. Urge incontinence is when you experience a sudden urgency to go to the bathroom, and you can also find yourself going to the bathroom multiple times per day, which is urinary frequency. All of these types of urinary incontinence and urinary issues respond really well to pelvic floor muscle strengthening, specifically with progressive strengthening of the pelvic floor muscles. Kegel exercises are a contraction of the pelvic floor muscles, and that's generally a first-line treatment for urinary incontinence and specifically stress urinary incontinence. But when you're just contracting the pelvic floor muscles alone, there is a ceiling to how far you can get. And that's where vaginal weights come in. Adding the vaginal weight adds a little resistance to the pelvic floor. It also cues the brain as to where the pelvic floor muscles are so that you can be sure that you're contracting them properly every single time. Additionally, adding that resistance helps to progress and really make gains towards strengthening the pelvic floor muscles to overcome urinary leakage. This is the Intimate Rose Kegel exercise system. It comes with 6 progressively heavier weights, where white is the lightest, and as the color gets darker, the weight gets heavier. It inserts similar to a tampon, so it just goes right inside the vaginal canal. The pelvic floor muscles work against that resistance to maintain it in. Everyone's unique and different, but most people progress from one weight to the next in 4 to 12 weeks. As you're building strength and awareness of the pelvic floor muscles. They are FDA cleared and made of non-porous, body-safe silicone, so it's a safe and effective way to help symptoms like urinary incontinence, some types of sexual dysfunction where the pelvic floor muscles aren't contracting rapidly enough, and helping with symptoms of urinary urgency. The reason I prefer silicone to plastic is because it's better tolerated, it feels more comfortable inside the body, and it's smoother and easier to insert and remove. The set comes with instructions and a discreet bag at the bottom of the box, so there's guidance and assistance on how to get where you need to go. You can find the full Intimate Rose Kegel exercise system at intimaterose.com, and if you found this video helpful, be sure to subscribe for more helpful videos, and if you have any questions, please don't hesitate to leave them in the comments here and we'll get them answered.